Okay, Dr. Shipra, you there? No?
Yeah, I'm there.
Perfect. So, would you like me to start the session
Yeah,
now?
yes.
Perfect. So, good morning, everyone. I welcome you all to this another exciting session of One Among You series, which is a pride initiative by Epistate Health Singapore. Now, this is a series, this is a series of talks by the experts in their respective field with the ideology of bringing the experts to your doorstep. And every time a new speaker is going to share their expertise on a innovative dental concept. This time, we are very thrilled to announce our new guest speaker, Dr. Shipra. So, well, without much ado, I'm now going to introduce Dr. Shipra. Dr. Shipra Mandwar, 1 minute please, has completed her MDS in prosthodontics and implantology from YMT Dental College and Hospital. With a strong academic foundation and clinical expertise, she has extensively studied implant surface modifications, particularly photo-functionalized implants. Her research in this field has earned her multiple awards at national and international conferences. She has also published numerous papers on photo-activated implants. Currently, she serves as head of the dental department as Echelon Hospital, Koparkhede, Navi Mumbai. So, the screen is all yours. We welcome you, Dr. Shipra Mandwar.
Thank you,
Yes.
Dr. Niharika. Thank you. So, good afternoon, everyone, and welcome to today's webinar. And thank you for joining in and being a part of this session. Today, we are going to talk about the fascinating role of plasma technology in dental implants. And I am excited to take you through this cutting edge innovation in transforming the implant surface modification and enhancing the clinical outcomes. So, the question arises, why do we need a plasma UV activator in the field of implantology? And to answer this, we need to understand a few basics and then we'll understand the role of it in the implantology. What is plasma and what is CAP? What is cold atmospheric plasma? We know there are different forms of matter which exist, like the solid, liquid, gas, plasma, the Bone-Einstein condensate, and the superfluid, which is recently added. Today, we focus on plasma. What is a plasma? It is a high ionizing, electrically stable gas. So, there are different kinds of plasma that exist in nature. It could be thermal, quasi-thermal, and non-thermal. Today, our focus is on the cold atmospheric plasma, which plays a very important role in medical as well as dental field. So there are many applications of the cap, and it was first introduced in the medical field to sterilize the instruments. But it is not just restricted to that. Now it has expanded to dentistry in the various fields and various technologies and techniques. So first, it was used to disinfect the teeth whenever there were caries. The caries had to be removed. We understand by with the help of the air rotor or everything, we remove the caries, but a complete disinfection can be achieved by the cold atmospheric plasma. It can also be used to disinfect the root canals after it is infected. Now we know that it was first used in disinfection. That means it acts against the bacterial cell wall. So it can be used in cases of periodontitis and gingivitis, where we need to get rid of the problems, the bacteria, and leave a good and a healthy gingiva. It has also been reported that it has been used in uh, to discolor the tooth surface and for the tooth whitening. But today, our main focus is on how it works with dental implants, how does it works with titanium, and how does it works with zirconia. But to understand this mechanism, we need to first understand the basics, that how does that implant osseointegrates in the body, in the jaw, and how does the implant works. So, the concept of osseointegration was first introduced by Dr. Ingvar Brainmark in the year 1978. Through this video, we'll understand that how does an implant osseointegrates with the bone. So, once the osteotomy site is prepared with the help of the drills and the implant is placed, the moment this is done, the process of osseointegration starts. The broken blood cells release platelets, and the platelets release different kind of messengers, creating a platelet plug. Now, this is the inflammatory phase where the endothelial cells squeeze out polymorphonuclear cells, and there is deposition, and there is destruction of the bacteria. But now that this dead bacteria has to be cleaned, and for that the macrophages come into the being and they clear all the dead bacteria, and now what we have is a clean surface for osseointegration. Now the process starts where the bone is going to adhere to the implant. The perivascular cells lead to the neovascularization, that is formation of new blood vessels. Osteoclasts and osteoblasts, play the important role by remodeling, and we have now the primary stability of implant where the bone is deposited and the implant is integrated. Now comes the remodeling phase, that when we load the implant, there's again osteoclastic and blastic activity with the help of osteocytes, and then we achieve our secondary stability. Now that we have understood the process of osseointegration, to enhance this, there are so many different ways to enhance this osseointegration. It could be on the macro topographical level or the micro topographical level. So, in the early 1970s, the implants which were created were of cylindrical shape, but with the studies and with so many researchers, we have concluded that a conical implant is more favorable for osseointegration. There were core vented implants, there were metal implant, different kind of metals were tested, and the titanium grade for implant has been established to be the best material for osseointegration. Now it doesn't stop there. Once we have achieved the macro topography, we move on to the micro topography of the level. We can do changes in the morphogenic, biochemical and physiochemical processes. Morphogenic means we are just changing the surface. We can do that by acid etching, sandblasting. And in the biochemical, we are like changing the we are applying PRP on the implant and trying to osseointegrate, trying to make it more favorable for osseointegration in all this process. One such process is physiochemical response of the body to the implant. That means how is body reacting to the implant. The work has been done there, like making it, if you make the implant electropositive, there will be more attraction of these cells and you will have an accelerated healing. Or you make the surface hydrophilic and the blood components adhere to the implant, and you get something which is favorable for osseointegration. So one such process is applying plasma to the implant. What does cold atmospheric plasma give us? It increases the biocompatibility of the implant. It increases the surface morphology. It cleans the surface morphology. It adds a positive charge to the surface, and of course, it was first foremost used for disinfection, and it treats implants and makes it antimicrobial. So how does that work? The studies have said, and it is proven, that the aging of implant begins almost seventh day from the day of manufacturing. We have our implants which have an expiry date of about 3 years, 4 years, but actually the aging of implant starts at the seventh day of implant from the day it was manufactured. So what does aging means? Aging means that there's a hydrocarbon layer which gets deposited over the surface, which prevents the direct contact of blood and blood components to these implants, and it is necessary to remove this hydrocarbon layer so that we can achieve something that will accelerate the osseointegration. Also, what does plasma do? It deposits a positive layer over the implant surface. We know that the osteoblasts are negative in nature, so the positive and negative attracts, and it makes the deposition of osteoblastic cells, and which will lead to osseointegration. The same thing we'll understand through a video, where this is the hydrocarbon layer which is formed due to the aging of implant. Okay, so now that we have applied the plasma, there are RONs, there are reactive oxygen and nitrogen species, which makes the surface ultra reactive and ultra clean. This is first thing. Now once the plasma is exposed, there you render a positive charge to the implant, which attracts the osteoblastic cells, resulting in better osseointegration and accelerated healing. Again, the third and one of the most important feature which plasma adds is the hydrophilicity. It makes the implant super hydrophilic. That means the blood components get attracted to the implant. There's deposition of blood components, which will lead to better osseointegration, which will lead to better adherence and accelerated healing of implant. You can see there's neovascularization, there's deposition of osteoblasts, and what we achieve is a well osseointegrated implant. And this gives us such a predictable outcome, and this is what all our clinicians are expecting today. Let me explain you a concept of stability dip of the implant. What happens is, during the remodeling phase of implant, the number of osteoclasts become a little higher than the osteoblast. So what you achieve on the day one of implant placement, the primary stability goes through a dip during the fourth week of implant placement, where the remodeling is happening. Okay, and at that point of time, the implant is very susceptible to failure, and you can't load the implant at that point of time. But what plasma is giving us is that there is a negligible stability dip of the implant. That means you can load the implant within a month. Imagine reducing the time of treatment from 3 months to 1 month. And imagine the imagine what plasma is delivering us, what plasma is giving us in the field of implantology. It is reducing the stability dip of the implant, and now what you get is a stabilized implant within 20 days, within 15 days, or within a month. I would like to show you how does hydrophilicity looks in the real time. How does the blood climbs over the implant when there's hydrophilicity? This implant was plasma exposed before placing it into the oral cavity. As soon as the implant touches the osteotomy site, the whole implant becomes wet. The blood climbs over it. The blood is climbing, and this shows the magnificent role of plasma on the implants. Now we can expect that the blood components have really adhered to the implant. There will be a predictable osseointegration and outcome of the implant. This is what we need in the clinic. This kind of proof we need, so that our patients can trust us and we can give them something which they can really appreciate, and they can have. Everyone deserves good teeth, and I think this is something very tremendous. These are the two articles which explains this concept deeply, and all the doctors in the webinar could go through. I can always share the link with this, and they have very nicely explained how does the plasma work with the implants. Now, the bigger question comes, what should be the time of exposure? Should it be 20 seconds, 40 seconds, 60 seconds? We are clueless. We don't know how much do we need to expose. So, this is a study which shows us that the antimicrobial effect or the cleaning effect is achieved within 20 seconds of plasma exposure. Okay, within the 20 seconds of plasma exposure. But it does not provide the surface energy or the hydrophilicity at 20 seconds. Okay. Now, there is one more studies where they have studied the impact of plasma discharge and the osteoblastic activities. And this article suggests that minimum 40 seconds of plasma exposure is required to achieve a positive surface energy and hydrophilicity. Now, the research is still going on. There are many number of researches in the literature where they have been researching about the exact time of plasma exposure. And we and there is one more article where this they suggest that uh, almost 60 seconds is required to completely achieve the hydrophilicity. So of course there are some plus and minuses of to there's a confusion of what should be the time of exposure. But what I have achieved through literature and what my conclusion of this is that the effective exposure time for plasma to make the implant effective and hydrophilic and surface positive surface energy is about 45 to 60 seconds. We need that much of time to make the best implant to give the best implant to the osteotomy site. So, this is the Epident plasma activator, and we know that there is a 20-second cycle on this machine. So, we have to expose it. We have to go to the cycle 3 times to make it completely effective for our patients. And I think giving a minute so that we can achieve so great results isn't a big time. So, if a minute can give you such a predictable outcome, then I think it is worth it. So now, as a clinician, the only question is why do we need this? Is it really required? We are still placing the implants and we are not. But are you sure after placing the implant that it will get osseointegrated? Are you sure that it will work in patients with osteoporosis? Are you sure that the patient won't come back with the implant in hand? No, we need that kind of predictable outcome. We need to see through our eyes that blood touched your implant and that the osteo integration will surely happen. Okay. Now the accelerated healing, the time period. Whenever we place an implant, we ask the patient that your crown will be placed after 3 months, after 4 months, depending upon the bone quality, depending upon the surgical procedure, whatever happened, if there's bone grafting and other things. But what if I tell you that a patient is traveling from US? This is a very common scenario nowadays that people travel from abroad to get the dental treatment done in India because we know it's expensive outside. And they just have a month. So what you'll say, you have to come back after 3 months. Or you'll say, I can't place implants and I'll give you the bridge because I can't, rehabilitate in time. No, we can't. We need to give whatever best is present for the patients. We need, if they say that, of course, there are some kind of factors which may affect the healing, but this you know confirms or gives you the confidence that you will be able to rehabilitate it in a month or so. So this is the positive points of plasma. That is why you need to incorporate it into your clinical practice. Prevention of peri-implantitis during the surgical procedure while opening the implant. There are so many things. You touch the implant surface, you have so many things that happen during a surgical procedure sometimes. And even if you try, sometimes the after the implant placement there will be bone loss, there will be peri-implantitis. But if you keep the implant in plasma for 20 seconds, it completely clears it from all the debris, all the microorganisms, and you are placing something which is pristine. You are placing something which is untouched. That and this will automatically reduce the chances of peri-implantitis infection after placing the implants, which we all clinicians some or the other time fear of. And of course early loading, because we need to rehabilitate immediately or within a day or within 15 days, and plasma allows us to do so. And these are some clinical situation where it will make a very great difference, though it will make difference in each and every implant case. These are some of the selected scenarios where it will really affect and improve the outcomes, like in the D3 D4 bone, where the bone quality is deteriorated. And as a clinician, you have placed the implants, but you have that question in mind where you think, will the implant also integrate? Will it come out? Will it be favorable? What will I do if it comes out? So, in such cases, when you know now that something is predictable, it just adds up to your confidence, and it just helps you to deliver something which is best for the patient. Anterior implants, people now are very concerned with their aesthetics. They can't live without a teeth even for a day, because they have their social gatherings, social meetings, people have to meet, people have to go out. And if you say, I'll place implant today and I'll place a cap after 3 months, tada, the patient will go, no, I can't stay. Then you will say that I'll give a temporary. But you know temporary is a temporary solution. What if you can give it the permanent the same day? What if you are so confident about your implant placement and that your implant with osseointegrate? Plasma UV activator gives us that confidence. And patients who are susceptible to infection, patients with delayed healing, like patient with diabetes, patient with osteoporosis, who have delayed healing, who are susceptible to infections now and then, for such people it will really make a good difference. And as I say, good teeth are deserved by all, irrespective of whether they have some debilitating disease, they have diabetes, they have osteoporosis. Everyone deserves a good teeth, and we have a chance to give them that. Now the question comes, why Epident? Why are we choosing this company? Why not other? First of all, this is first in India to provide this technology for dental implants. We have few UV activators, that is ultraviolet activators, but plasma activation of implants, this is India's first company which is providing. And let me tell you, this is not a new technology. This has been practiced in Korea and Germany for a very, very long time. The first article I found about this was in the year 2012. Today it is 2025. So it is not a new technology, but Epident took the initiative to bring it to India. And secondly, the most important thing is you don't need to change your implant system for this. It is an open system compatible with all the implant companies. You can use for any implant company. You have to just place it here. So it doesn't change your implant system. You don't have to buy a new kit to place a plasma activated implant. Whatever setup you have as a clinician, you can just add to it, and the miracles will happen. There's a minimum chair side time. Increasing 1 minute of your chair side time, but giving a predictable outcome. I think we all need this. And of course, there's ambient air operation and there are no external gases. So this is environment friendly. It is perfect for your clinical setups. And I suggest we all should have one of these in each of our clinics. Any questions? Okay.
What a
So
wonderful, Mhm.
So
Wonderful.
plasma is a ray of light to perfection, and these are my contact details. If you have any kind of question, you can call me, mail me, or you can DM me on Instagram. Thank you. Thank you so much.
What a wonderful presentation, Dr. Shipra.
Thank you.
So,
Thank you.
heartfelt thank you to
Super,
you
super.
for this incredible, insightful, clinically enriching session on plasma activation in implantology, and especially your tips about the use of plasma activator was sort of in transformative, was nothing short of transformative, and we are certain that our audience will greatly benefit from your expertise. It was an amazing presentation, including the basic concepts. Very nice presentation, Dr. Shipra.
Thank you. Thank you so much.
Yeah, I request if anybody has their doubts, you can please ask. The recording of this session will be available on our YouTube channel. So So you can go through the recording. Also, as Dr. Shipra has been very generous, she has shared her email ID. So if anybody has any doubt, please feel free to contact either her or me. We are always there to support you. My
Okay.
team is also there. Mr. Haren Verma from Epident and Mr. Nihar from Epident. So please, if you have any doubts, please feel free to contact them.
Thank
Thank you,
you.
Dr. Shipra. It
Thank
was a
you.
lovely presentation.
Thank you so much. Thank you.
I have just one small doubt when you
Yeah,
mentioned about
sure.
time of exposure, right?
Correct.
Plasma
Correct.
activation, that's from 20
Correct.
seconds till 60 seconds. So,
Yes.
what is the criteria to decide the time of activation, the time of exposure for activation?
So actually, in long researches have been done, and they have, studied on the micro level that whether
Hmm,
it is getting a positive charge or not. So after 20 seconds of exposure, they were not getting that charge. So
hmm,
after 20 seconds of exposure, they were only getting a disinfected surface,
hmm,
but not the charge. So due to the studies done in the literature, we come to a conclusion that um 45 to 60 seconds is the ample amount of time. What we are looking to achieve is something like super hydrophilicity.
hmm,
For
hmm, hmm.
that we need that amount of exposure over the implants.
And does it depend upon the composition of the implant and the
Yeah,
type of implant we are using, you know?
sure, sure, it does. So basically, whatever I spoke about was mainly about the titanium implant. If it is
Hmm,
made up of a fourth grade titanium implant, everything applies. For zirconia, the time is less because it is more porous in nature. So it allows plasma to get absorbed quickly. So if it is a zirconia implant, then you have maybe it is around 30 seconds or 20 to 30 seconds.
okay. And when you talk about titanium implants, so this rule of 45 to 60 seconds is applicable to all the titanium implants?
All the titanium implants. So basically, we are just dealing with titanium per se, the
Hmm,
metal
hmm,
titanium.
hmm.
So
Okay,
the plasma to penetrate into the titanium, we need that kind of time.
okay. Okay. And yeah, that was very nice. Thank you so much.
Thank you. Thank you. Bye bye.
Thank you. Thank you, everybody. And just sharing a small token of gratitude from our side to
Yeah.
Dr. Shipra. One second, please.
Thank you, Dr. Sipra.
Thank you. Thank you. Thank you so much.
Super.
Thank you, Dr. Shipra.
Thank you. Thank you.
We are looking forward for more such informative sessions
Sure.
from your
Sure.
side.
Sure.
Thank you. See you then.
Thank
I'm going
you.
to end the meeting now. Thank you so much.
Okay. Thank you.
Bye-bye.